We are able to fully assess the ear, identify pathologies early on, and treat them.
Hi, Dr. Lau, how are you?
I'm very well, Mr. Wong. How are you today?
Not too bad at all. How's your week been?
Well, funny you should ask. This week, I've seen many patients with troublesome earwax.
So what do you normally do with them?
Well, besides the usual topical eardrops, my go-to is microsuction.
Microsuction, huh? Can I ask you why?
I believe that microsuction is the gold standard for earwax removal. It's safe, it's precise, we perform under direct vision using a microscope.
I couldn't agree with you more. As ENT consultants, I believe that using the microscope, we can remove earwax very safely, but we can also manage the most complex ear cases, ranging from active infections to a perforated eardrum, from very narrow ear canals to patients with previous ear surgeries.
What patients also need to be mindful of is that microsuction isn't just about earwax removal. We are able to fully assess the ear, identify pathologies early on, and treat them appropriately.
So come to LIPS for safe and efficient ear care. Not only that, we have short waiting times.
Please see the description below for more information.